everyone, it's Andy here. We decided to do a little story today about the 20-week ultrasound. We have a lot of pregnant mamas out there and a lot of people who are expecting, so we thought just giving some basic background and information on one of the normal pregnancy tests that everybody will get during their pregnancy would be helpful for everybody. So I recently had my 20-week ultrasound, so I went ahead, I took some pictures for you guys, and I'm just gonna talk through about what it's like, kind of what to expect, how the process goes, because it's a little bit different than your normal OB visit. So what typically happens is your OB is gonna give you a prescription or an order for a 20-week ultrasound, and you'll schedule that during your 20th week of pregnancy. Usually this will be at specific ultrasound facilities. In my case, I went to the hospital at their perinatal testing center. So it's kind of a little tricky place to find sometimes. So it'll depend a little bit on your area and where you're from. But usually people are really helpful at getting you the directions that you need to get to where you need to be. For preparation for before this ultrasound, they'll usually want you to drink a fair amount of water ahead of time, at least an hour beforehand, so you have a full bladder. This will allow them to check both ways, both abdominally over your belly and transvaginally, depending on the position of the baby when you get there. So they like you to have a full bladder because it's easy to empty a bladder than sit and wait for it to fill when you're at the testing center. So what they're looking for on this ultrasound is the baby's growth. They're gonna double check when your last menstrual period was or when your estimated due date is based on your transfer date or however you got pregnant. And they'll use this information to calculate the length of different bones that are starting to form for the baby. They're gonna take all of these measurements and look at all the major bones like the femur, your radius and ulna in your arms. I'm like trying to remember where all my bones are. They take a really thorough look at the skull and the different chambers of the brain. And they're also gonna pay really, really special attention to the baby's heart. So they're gonna look to see that that heart is beating normally, and they're gonna look specifically at different views for the different chambers of the heart. It's pretty incredible because all of this information we can already tell by just 20 weeks of gestation. Also during this ultrasound, a lot of times the newer ultrasound machines have this 3D technology. So sometimes they can switch on the 3D technology and give you this like live version of what your baby's face looks like, which can be kind of cool, but also make you think that it kind of looks like an alien, which is also, it's a totally normal reaction. More often than not, everything runs smoothly. It's a longer ultrasound because they're doing so many different measurements, but you wanna make sure that they're checking everything really thoroughly for you. The other things, if they notice anything that's unusual during this time, usually it's related to the major organs of the body, or any major developmental issues that might be happening with the baby. They'll discuss that with you right in person at this ultrasound. So there's usually doctors there at the site who will come in and discuss what the findings are, if there's any required follow-up that you need to be having, and if there was anything prior that had come up during your pregnancy, earlier in pregnancy, if that is looking normal or still looking like a concern moving forward. So I have a couple of pictures that I took when I went for my 20-week ultrasound of the room that I was in so that you guys can see what a typical setup looks like, kind of what the exam bed looks like, the big TV screen that they have now where they're gonna project the ultrasound images so you can see exactly what they're doing in live time. They usually have like a few chairs, so if your partner wants to come, or maybe your mom, somebody like that, someone close in your family, they usually can accommodate those things, so that's always nice too. So you can have a little bit of idea of what to expect at your site. So this was just the sign for the perinatal testing center, which is where I had my ultrasound. The second image is the typical bed that they'll have, which you'll see is right next to the ultrasound machine. And even though you can't see on the ultrasound machine in this next picture, you can see the big TV that they have set up. This big TV is where they'll project the ultrasound images so that you can see what they're seeing on their machine. And here is a picture of the ultrasound projected up onto that screen as we're laying in the bed. So you can see it right from the perspective that you'll be seeing it. And then a cute little picture of my little baby who's growing inside of me right now. If you guys have any questions about any of your prenatal testing or any concerns, worries about before or after, and you ever want to talk, we're always here for you on chat, or you can reach us on email. So feel free to reach out at any point.